I'm Pat Gulhati. I'm an assistant professor of medical oncology here at Rutgers Cancer Institute. Colorectal cancer is a disease that develops from the cells that are lining the colon or the rectum. This usually starts as an abnormal growth called a polyp, which over a period of time can develop into a cancer. So the symptoms of colon cancer can be somewhat vague and nonspecific. Some of the common symptoms that we often hear patients tell us are abdominal pain, bleeding, blood in the stool, anemia on labs, change in bowel habits, lack of appetite, or change in weight, specifically weight loss that's unintentional. So some of the risk factors associated with colon cancer include genetic syndromes such as Lynch syndrome, having a first-degree relative with colorectal cancer, a prior history of radiation to the abdomen is another risk factor. There are also some lifestyle factors which can increase the risk of developing colon cancer, and these can include smoking, excessive alcohol consumption, obesity, or a diet that's rich in processed or red meats. So screening for colon cancer is crucial because it can allow us to detect pre-cancerous lesions in the colon and rectum and remove them. And this will prevent the development of colon cancer. The recommended age for starting screening for colon cancer is now 45 years old for people who are at average risk. And if you have a first-degree relative who developed colon cancer at an early age, you may actually benefit from starting screening even earlier, sometimes at age 40 or 10 years younger than the first-degree relative who had colon cancer. Clinical trials are crucial in treating cancer, not just colon cancer, but all cancers. Some of the benefits are that they allow access to new treatments that are in development and will be the treatments of the future. There are many different types of clinical trials ongoing in colorectal cancer here at Rutgers Cancer Institute. Some of them are detecting earlier signs of cancer in the blood using a technology called circulating tumor DNA in patients who have undergone surgery for colon cancer. There's other trials looking at new medications to treat cancer, colon cancer specifically. There are also trials that are looking at microbiome products which can reduce the symptoms from colon cancer treatments such as chemotherapy. And then lastly, there are also trials ongoing which are looking at combinations of radiation and chemotherapy to treat colorectal cancer. So NCI-designated comprehensive cancer centers are special places because they have a wide range of research, including lab-based research, clinical trials, and population-based research. So Rutgers Cancer Institute is New Jersey's only NCI-designated comprehensive cancer center in conjunction with RWJ Barnabas Health. And what this really means is that we have a wide range of research ongoing, including lab-based research in colon cancer, clinical trials in colon cancer, as well as population-based research. And what this means for patients is that it allows them access to the most cutting-edge clinical trials that are going on, and these trials may not be available elsewhere.